Hey, like the other registered on live now. A very good afternoon to all the BabyChakra viewers. A very good afternoon to all the viewers of BabyChakra. Nice to be among you. This is Dr. Sudha Padmasri, consultation on BabyChakra with the code SUDP. Today afternoon, I'll be discussing all the complications and what to do in your pregnancy and A to Z about pregnancy related issues. And first, I would like to tell you about all the frequently asked questions in pregnancy. So, pregnancy to a woman is a great miracle that is happening in her life. Okay, she's very. There are several women trying to become pregnant but unable to do so. So today I'll be telling about you what are the preventions and precautionary measures that are to be taken in a to conceive. So first, once a woman is newly married, the people first up to they can some women after that when they come to us wanting to become pregnant, then they would like to know which is the ideal time for a man and a woman to take part in the physical relation so as to conceive. So I would not become pregnant. So suppose if a woman wants to conceive, then and if she's getting regular periods, ideal time for her to conceive would be between the 12th day to the 16th day. If she takes part in the intercourse between 12th and 16th day, that is the time when she would be able to conceive diet rich in all this folic acid, especially a healthy diet rich in proteins and basically before she starts up her pregnancy, make sure that the hemoglobin is adequate and she should be in a healthy state both mentally and physically able to be facing. So we will start any woman who trying to conceive with levels are in the right normal euthyroid state, and then we will allow her to become pregnant. So what are the complications should we see? The moment she misses a period, some women would be like things and all in the early morning. So the first indication that a woman is pregnant could be the early vomitings that she gets in the first 3 months of pregnancy. So the moment she misses a period, she might have something like a reeling sensation. She might want to sleep for longer periods of time. She might feel heaviness in the breast. Pregnant woman might develop. There is nothing to develop and there's nothing to panic. These are the natural sickness, and we would advise her to take some medicine such as doxynate or some antiemetics and rich in ginger. And so we advise ginger in the ancient times was supposed to be a very good medicine, home medicine to prevent the early morning sickness. So any foods rich in ginger, like you can take ginger soaked in salt and lemon, and then she can try that, and she can keep on putting in her chew and chewing a lot. Doesn't have that nauseating sensation. Or she can take medications. Any antiemetics can be taken under the supervision of a gynecologist. Then suppose she's having the reeling sensation and all. This is a pro-pregnancy hormone that is being secreted, and that also because of that she'll have that heaviness, and she feels that heaviness in the breast could be to the hormones that are being secreted in pregnancy. These are all natural phenomena, and there's nothing to panic about. So, but the certain warning symptoms are there in the first trimester of pregnancy. That could be one. Few of them could be that she can have a little bit of spotting. And if she's a spotting and all, then she must immediately consult a gynecologist. And the things that early first trimester scan. The early first trimester scan is generally done around 6 weeks of pregnancy. We would like to know the most important location of the pregnancy, whether the pregnancy is located in the uterus, in the right position or not. Sometimes it can happen that some people might have the pregnancy in the tubes. It is called an ectopic pregnancy. Make sure that the sac is regular, the implantation is right. There is a fetal and there must be cardiac pulsations at least by 6 weeks. So these are the things that we would like to know whether the pregnancy is viable or not, whether the implantation is good or not, and these are the few of the things that we would like to follow. Then that is in the first trimester. Then any bleeding or spotting or any brownish discolor immediately to have an appointment with the gynecologist. Now that's the first time. So this I'm telling in brief. And now when it comes to the next 3 months, next 3 months are very important. This is all the prime when the maximum organogenesis is going, the fetal is developing. So in the second trimester, that is the second trimester is between the fourth, fifth, and 6 months. In this trimester is the time when the baby is actually forming. So we would look for around 11 to 13 weeks. I would prefer to go for an NT scan. That's called the nuchal transpositions. It serves to detect any early congenital anomalies in the babies. So this is very, very important. An NT scan in the first trimester, that is the late first trimester, that maybe around 11 to 13 weeks is done. At the same time, we would like to do double marker test. And the first trimester itself, we would like to do other investigations, blood investigations. What are they? They could be the baseline hemoglobin percentage, the baseline investigations, whether she's a diabetic or not, her RBS, her blood grouping and typing, and the other things would be like these are the minimum tests to be done actually. And the other ones would be like a viral screening, whether she has HIV or HAV and any other problem she has. These are all to be taken in the these are the first baseline investigations in the first trimester. Coming to the second trimester, we would like to get her most important thing is TIFA scan that is done roughly done around 20 weeks. This is a targeted imaging for fetal anomaly scan. The anomaly scan rules out any neural tube defects, if the baby is formed well or not. If there's any other defect, we would like to further investigate. And then at this stage, you would like to get a quadruple marker test to make sure that the baby is perfect. Baby is quite healthy and there is no other anomaly. This is a scan that is done in the second trimester. Around 28 weeks, if we are suspecting any problems, we would like to go for a blood sugar, hemoglobin percentage, urine sugar, a routine urine examination. These are the minimum basic tests that have to be done in pregnancy. And then the tetanus toxide is given. Generally, we do it rural areas. We used to do it the early first at around 3 months. But maybe you can do the fourth month. You can give a tetanus toxide, and within 2 3 months gap, in the third month, the seventh month, the second dose, where we generally give a Tdap injection. So in the third trimester, what are we looking for? We must be carefully monitor if the patient is developing any gestational diabetes. This starts from whether she's developing any gestational diabetes, whether she's developing any pregnancy-induced hypertension, or whether she's developing any complications, whether hypothyroidism is or thyroid is functioning on. So these are the things which you would carefully monitor in the second trimester. The third trimester, we are reconfirming that she is not developing any diabetes over diabetes or she's developing any hypertension. And these are we are carefully watching for her the growth of the monitoring the growth of the baby. In the third trimester, we would give her, as I had already mentioned to you, and that at the same time we would check for the interval growth of the baby, making sure that the baby is growing well. The ninth month of pregnancy, you would prefer to do a growth scan or the late scan. This is called in this is the growth interval growth proper or not? Is the baby is the intrauterine environment things that we would like to look for in the last month, this last month scan, that is the 9th month scan. So once the medications, if the woman has a very good hemoglobin, there is no necessity to anemia, and then her iron stores alone. Then it's always advisable to give her an iron supplementation. The supplementation can be started in the second trimester iron, and we give her for minimum 100 days. 100 days with your hand. So you can supplement her with iron and the other medication that are a multivitamin. You can give her a protein powder supplementation if required. If you feel that she requires some protein supplementation, and we would prefer some calcium for the bones of the baby. Now there is no necessity for the supplementation of the baby. So your diet should include a simple advice to when you see the plate of a pregnant woman, it should be multicolored, at least 6 7 colors. Your rice is white, your dal is yellow, your green leafy vegetable green, then tomatoes orange, and you have a number of vegetables and you have eggs. So at least you must have 2 boiled eggs a day. A glass of milk is a must. For the vegetarians who cannot take egg, you can take paneer or alternates to the egg. You must have at least a good green leafy vegetable must with the pulses like any dal and a vegetable curry. Less amount of fat that you go. You can use ghee, which is good, and you can take diet in moderate quantities spread over the entire day. So generally, we breakfast in a pregnancy, you can divide it into 6 meals. The breakfast can be taken into 2 portions. One, one in the breakfast when you take it at 8 o'clock, and the mid-morning meal that's around a small snack. At 12 o'clock or 1 o'clock, you have your lunch. At the mid-afternoon snack, you have, and then evening you have your dinner around early dinner at 7, and then you have a around 9 hours. This is the spacing of your food. So this will help the woman to get energy all throughout, and she is not having a spikes of glucose levels spiking up. So these are a must in every pregnant woman's diet, and these ought to be. Uh, that is also good because animal proteins are quite good. The bioavailability of the animal protein is very good, especially if we have DHA and essential amino acids. That is very good. So this is coming to the pregnancy. Now coming to the obstetric other things. So if a woman develops, she can develop high pressure, she can develop diabetes, she can develop other problems. Or suppose if you are having a woman with any other medical disorder, she's at a high risk factor. If a woman has twins, that's another different problem. These all elements which cannot be, and we need a single session for each problem. Now, suppose if we come to the obstetrics, this is about the obstetrics. Now, coming to the gynecological problems. Gynecological problems based upon the age of the individual. Okay, suppose if I have a young girl, recently attained menarche, maybe 13 reading. See, she can have amenorrhea. 6 months she's got attained menarche. 6 months she might not get periods. Then she starts developing bleeding and she keeps bleeding for 2 to 3 months. These are few of the problems generally seen with young girls. So these girls need to be, first of all, they are having anovulatory cycles. That means their egg is being menstrual. These type of women, they tend to bleed longer. These are young girls. But the problem is that they are highly prone to develop anemia. So good alimentation, foods which iron should be supplemented. Now, if I have a woman who's around 16, 17, 18-year-old girl coming to me with the intermediate and early degree girl, what problems do they have? They have PG problems. They say that, see, doctor, we are not getting our periods. We have irregular cycles, 2 to 3 months. We don't get our periods. And once we get our periods, we bleed for 15 to 20 days. That could be a polycystic disease. We advise them diet management and lifestyle management. Lifestyle management is must regular exercise. They should take part in regular exercises and stress. And if you have an elderly, a young woman, a reproductive age group who's trying to conceive and she can have infertility problems, then we can treat it accordingly. Suppose if you have another thing, you can have bleeding problems, irregular cycles, excessive bleeding during periods, and all these problems. So for each problem, you need to take a different session. So do you want to, like suppose problems in reproductive age group, menopausal women, then what type of problems we can anticipate in they can have? Elderly women can have any problems such PV. White discharge is very foul smelling. Then excessive vaginal discharge and there's be foul smelling vaginal discharge and discharge associated with vaginal itching. So many women, young girls are there having excessive vaginal itching. They feel uncomfortable when they are attending to their classes or then they're in the public and all that. And then also see, you have young, after this age, there are young women who have this frequent urinary tract infections, commonly running to the toilets, excessive severe lower abdominal pain, clamping and all that stuff. For me to discuss all these in the single go, but you can always use my code. I'm to Sudha Padmasri, and my referral code is SUDP on BabyChakra. I'm available for online consultation on BabyChakra on SUDP. My code is SUDP. And then the elderly age group, the menopausal age group, and those type of women will generally be having problems or you have to exclude. Suppose they could have fibroids to be one problem, or they can have some cervical problems, or they could have other side of the coin problem like a cervical malignancy, endometrial carcinoma. They can have several other problems. So depending upon the age groups, they have a numerous number of problems. So if you have any of a gynecological problems, do consult me on online on BabyChakra with my referral code is SUDP. So this is a brief introduction. We should start the question session.